Hello and welcome to Foreign MD. I'm so excited today to have Dr. Folake here with me. And this is, as you know, Foreign MD. Here we interview foreign medical doctors who are able to successfully transition to practice in a different area from where they trained. And so Dr. Folake is going to share her story with us. So thank you so much for agreeing to be interviewed today, and I'm excited to hear your story. So, could you tell us just a little bit about yourself?
Thank you very much, Ali, for inviting me. My name is Folake Kofo-Idowu. I am a board certified internal medicine and infectious diseases physician. I currently work as a locums physician, mostly as an ID consultant, as I'm ID attending, and for much less of a time as a hospitalist,
Okay,
just to feel, yeah.
awesome, awesome. So, where did you train initially before you came over to the United States to practice?
I did my medical school at Lagos State University College of Medicine in Ikeja, Lagos.
Okay, awesome. So, what was your journey like over there? Like, did you finish and decide to come over here, or can you walk me through that process?
So it, I think since I was in medical school,
Yeah.
I had wanted to do residency abroad.
Okay, okay,
And it
okay,
wasn't just, oh, I want to leave abroad. It was, I wanted to train to
okay.
become a specialist abroad. Initially, I wanted to do surgery. I was in between neuro, ortho, cardiothoracic. Um, I did the primaries exam, to get surgery. I think I did it 3 times. There's the national, there's the West Africa. I didn't pass it.
Oh, wow.
And I I tried to, but I didn't let it get me down because I
Yeah,
just looked at the questions on the exam like this is not making a lot of sense as what you're using to get people across.
yeah,
But the good thing was in me trying it, it wasn't actually my full decision. It was my mentor that was trying to encourage me to stay because, you're going abroad, you might not get what you want,
yeah,
get to just,
yeah,
try to stay. I'm here, we can work. But deep down, even when I made the decision in medical school, I just knew that the kind of doctor I wanted to be, the
yeah.
kind of care I wanted to give, I didn't think that the environment I was in would give me that kind of training.
Wow.
And I I have a mantra that is it's those who know better that have better opportunity that have the opportunity to do better. And
Absolutely.
I wanted to change what was around me. And I didn't think that being trained by that system
Yeah,
all the way um put me in the best position or in a better position to improve it. So I knew
yeah.
that I just had to get better training. I had to see and experience more. Dreaming of more is different from actually experiencing more
True.
and being able to put that in practice. So when I didn't pass the primaries, I'm like, oops, it didn't work out. Back to my original plan.
So you started out pretty much training as a surgeon,
No, I started out wanting surgery.
wanting surgery.
Uh,
Okay.
yes, interesting. So I moved to the US, and in moving, different people, studied for USMLE in their own way.
Yeah.
I knew how best I studied, and I knew that I needed a structured environment. Otherwise, I just wouldn't get it done. I
Hmm.
needed a structured environment. So I actually registered with Kaplan.
Okay.
And
Okay.
I was able to get a student visa under
Okay.
Kaplan Medical.
Oh, wow.
So
Okay.
so when I left Nigeria, I had done my NYSC, of course, all of this with multiple delays, done my
Yeah.
NYSC, worked for a wee bit, probably less than a year or about a year to when I
Okay.
finished NYSC. And in the summer of 2011, um, my visa got approved and I moved.
Oh, wow. That's new for me. I actually never did know that you could get a student visa with Kaplan. Oh, wow.
Yeah,
Oh,
because they do have, sorry to interrupt you.
oh, you're
They
fine.
do have a like a course, course study course.
Yeah.
You have self-study, where you can use their videos, you subscribe, and then they have the live prep also. So you can do a combination
Yeah.
or either, and that gives, the only thing is obviously it's almost like a school. You have to come to school and be physically present for at least 20 hours a week.
Okay.
So
Okay.
I know the things have changed. I don't know what they have now, but if people look into it, they can check if they still have that.
Okay. So we come here, we start at that time. Did you just, when you came to the States, you just dove straight into preparing for your boards?
Yes.
Okay. How long did it take you?
Ooh. I know that I got my CFMG certificate, which was after you completed the step two. 2012? I think it was 2012 or
Okay.
2013
And you came into
that
the States when?
I came in summer of 2011.
Okay.
I remember well, I did my CS because it was around the time that CS was changing.
Yeah.
And
Yeah.
most of us knew of the, the oldish. And so I was like, okay, I gotta do this because I can't start learning. So I had to on I had to put a pause on my step one
Yeah.
study and just quickly, revved up on the step two CS. Then doesn't exist anymore, but the step two CS, which is clinical skills,
Yeah.
and studied like maybe 2, 3 weeks. And it was because we were trying to get dates and
Yeah.
everything booked because everybody wanted to get the exam done. And I
Before it
remember my
changed.
we had this like Firefox reload, auto reload thing. Like we weren't sleeping. You would wake up and you just stay up all night. And I remember I lived in the DMV area in
Mm-hmm.
Northeast, and I just saw this date. So you have like four screens because I think 4 or 5 screens. They had like different locations, and you had each page on reload. Each page
Oh,
on reload.
wow.
I remember I got a date, boom, on in California.
Oh, wow.
And I didn't think how I was going to get to California. I just knew I had to take this exam. There's a date, and I just picked California. The funny thing is, the date I got was actually in 3 days or five. I knew it was in less than 5 days because I picked that date. I knew I had to buy a ticket,
Oh, wow.
and um, and had I know I had my uncle drive, my grand uncle drive. It was late. I said I needed to go to the ATM, and he was like, "That's late." So he drove me to the ATM. I went to use my Nigerian card to withdraw some cash. I knew I went out that night to do something, and I called my like family friend, cousin, Nigeria. Once
Yeah.
you guys together, we're now cousins. Was in California. I'm like, yo, bro, I got a test. I'm coming over. I need some help. And he was like, I got you, I got you. So he picked me up from the airport, got me sorted out, took me to my test center, all of that, and showed me a nice time,
Oh, wow.
obviously. So
Oh,
I did that, yeah, like Q1. I knew it
mm-hmm.
was Q1 2012.
Yeah.
And then about a month later, I did my step one.
Oh, wow. So you got your stuff done really quick.
I did. I tried to because I noticed that it took me a little longer, but than I probably wanted because I just knew that it's a lot of material and people get frustrated. And
True.
I knew
True.
one, personally, my own attention span, when I just get pissed with material, like this thing's taking too long, my brain was, and I
Yeah.
didn't want to get that point. And also your brain fatigues are learning the same. I can't read the one thing twice.
Yeah.
My
Yeah.
That's skipping the word. So I just knew I wanted to do this not more than 9 months. If there was any problem, maybe a year, and that was it. And I think I took it probably in less than a year.
Oh, wow. Oh, wow. That was pretty quick. And that was awesome that at this time were you working?
Uh Student visa. So
Okay. Okay.
technically you couldn't technically you could work actually in school, and I was lucky.
Okay.
I was lucky that I got a job in my school, but it was again the summer of 2012.
Okay. Okay.
It
So
was the
that
summer that I
so
got a job.
you were able to at least devote that time to actually prepare for the exams, because like a lot of people take it in a lot longer span than that. So the fact that you were able to do everything in just a year pretty much speaks to them, the volume of time that you put into preparing for it.
Yes,
Okay.
it's yeah.
Okay, awesome. So we take our boards, we finish it, we pass. What does application look like for you at that time? What were you looking at? So was internal medicine your focus then, or what were your options?
Surgery was my initial focus. Surgery is
Okay.
what I wanted to do. And honestly, up until the last minute, I had letters of recommendation. I had everything. In fact, it took me that long to apply because I wanted to have like the best, get the better foot in the door as much as possible.
Yeah.
Is what made me wait, because people were applying with like for internal medicine with like awaiting CK results or awaiting CS result. And I think I wanted to even have my step 3.
Yeah.
So
Yeah.
if I knew I wanted to do internal medicine from a start, I probably would have applied without step 3. But I'm like, no, I want them to be like, this is bankable.
Yeah. Yeah.
On the last minute, it was actually the day to hit the submit button. That's September 15 or September 16.
Yeah. Yeah. Yeah.
And there were just some circumstances and I changed my mind and I had to scramble,
Oh
get internal medicine letters. Yes, get internal medicine.
wow.
And I switched to internal medicine. And I was lucky. I mean, I think, of course, there's some things that play into helping you. I was 99% on step 1.
Okay.
My step 2, I don't know, maybe it was like a little less than that. And because I had all 3, I think
All
that
three.
helped.
Okay.
I had some rotations, externship or observerships, and
Mm-hmm.
had some good letters. So I think those helped too.
So how many programs did you apply to? Like how many interviews came up? Like was it a thing where you had just many choices or was it just one choice?
I had a few, but very few
Okay.
interviews because I didn't apply. I didn't submit early again, and I didn't apply far enough. And that's a
Okay.
lesson that I learned because it didn't give me just wide enough opportunities. Naively, I was like, oh, I wanted to stay in the area, because of the circumstances that made me change.
Yeah.
Like it wouldn't make sense if I'm changing but then again, you go through residency and you hear other people's story. I'm like, I could have done, but again, I'm a person of faith, and I
Yeah.
just know when God has ordained your journey to be in a certain way,
Yeah.
the circumstances will come. You can blame it on the circumstances, but at the end of the day, you are
You look
literally
back.
just fulfilling destiny. And those things are just nudging you towards what God has written down. So I had very few interviews and I was lucky that I matched.
Oh wow.
Um,
So first time you matched.
yes, first time. First time I matched, yes, and I was lucky. Yeah.
That's awesome. So we get into residency at this time when you go in, was it everything you expected? Like how was your residency journey? Like was it smooth sailing? Like you just go, crush it from your first year intern, like, or what was that like?
So there was culture shock.
Okay.
There, I think, trying to remember it, the work was hard. And I tell people who are not in medicine, like residency is I don't want to use words, but residency, everywhere I'm learning because you're hearing people's story. Like medical training
Yeah.
is a crusher just by itself. And
Yeah.
then transplant. I call myself a tropical transplant. You're a
Okay.
transplant from a different environment. I wasn't even coming from
True.
England. I wasn't coming from a Western country. I was coming from a place where everything was different. We were using paper charts. Like you would
Yep.
see a
Yep.
patient, and I could do some chickenish scribble on the chart and call it a day, and it would be good enough. And you're here where you have to do a 10-point review of system, otherwise your note is not complete. You
Yep.
have to do this, you have to do that. Um, so there was culture shock just in terms of the expectations. And I think that is one of the places that IMGs are done a disservice in a way.
Yeah.
But also, I guess that's why programs want you to also have
Some
an
experience.
observatory or US
Yes.
experience.
Yes.
However, the experience you are having is not many times it's not so much of as a trainee, except you're put in a place where there are medical students you are working. But usually when you're doing observership and you attach yourself with a physician, many times they're not telling you this is what to expect, this is how
Yes.
to present, this is, so
You're just
there was,
looking for the most part with observerships. You
yes,
just
you
follow
are
them around.
looking in, if they're nice enough, they're asking you questions, you're answering. When I got in there, I realized that I thought residency, I'm coming to learn. Yes, you are coming to learn, but it's almost as if they expected you to come with 70-80% of the knowledge and to demonstrate that, oh, I know this already.
Yeah.
And you guys are just maybe fine-tuning the knowledge for me or
True.
showing me how to apply it to patients and
Yes.
everything. Something study, so and I'm like, USMLE didn't talk about like, so I'm very clinical focused, and my
Yeah.
program at that time now started to shift into this very research heavy,
Studies, everything followed by the
even
studies.
doing the research, just talking from research point of view.
Yeah. Yeah.
Yeah, in that way. And some of us, we noticed some of those people who were, I call them touch points, who were very good at those touch points, they weren't good clinicians.
Yeah.
So
Yeah.
I observed that. I'm like, yeah, because something I service in Nigeria, they were doing that kind of like, oh, they know the program director or whoever likes to hear you when you talk about, oh, some nice sugar trial, oh,
Yeah.
this trial, that
Yeah.
trial. And I'm like, yeah, but how are you taking care of your patients?
Yeah. Yeah. Yeah.
So I focused on my strong suits
Yeah.
and tried to pick up on some of those other things. Like, okay, but it was a bit challenging because you're like, okay, imposter syndrome, I'm not good enough, whatever.
It
But
is so
then,
real that I mean we don't talk about it enough, but it
yes.
is so real.
And many times imposter syndrome is not just internal,
Mhm.
honestly. There's a lot of external factors that are reflecting back to you and showing you like, oh, you're deficient in this area, you're deficient.
Yeah.
But I just told myself, when I see my patients, I hear their feedback, I see how they react to me, and I focus on that. Like, I'm a very good clinician and I
Mm-hmm.
do great with patients. And I will stand on that and then
Mm-hmm.
build the other part. So, and I didn't get in here because someone was handing out peanuts. I got in here because I worked
You
and
worked hard for it.
found some value. Exactly, they found some value in me.
Yeah.
But it was a lot. Residency was a lot of hard work. First year, when thank God for my best friend, because one of my best friends, we met in intern year, and
Yeah.
I think I got through that year because she was there.
Oh wow, that's awesome.
And when she wasn't there, and when she got to where she was going, because she did a transitional year and went
Okay.
on to another. By second year, we were both like, oh my God. Wanted to quit, and you talk each other out of it. And like, okay, we can do this. What can we do? La da 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 da. And there was a lot of tears. There
Yeah.
was a lot of, I'm going to quit. There was a lot of, when I finish, I think I'm going to take a gap year. My friends were like, oh, girl, no, you are not gap year. You're not going to let this person win.
Yeah.
Going to go on to your specialty training, because I wasn't crazy about being a hospitalist. So I was like, I'm going to do fellowship. And then
Did you know right from the start that it was infectious disease, or was that?
I think I moved specialties. I wanted critical care
Okay.
after I wanted critical care, and I liked cancer immunotherapy,
Okay.
specifically cancer immunotherapy.
Okay.
But to do that, I know you had to go and do hematology
Hematology.
oncology.
Yes.
And so initially I was playing with the idea of heme onc.
Mhm.
But I did rotation and I'm like, cancer every day.
Yeah.
Me, my heart cannot handle it.
Oh
It
wow.
would, I just knew that psychologically, I didn't think I could handle, and I'm like, just so. And wanting to do cancer immunotherapy also meant I needed to be research, clinical, lab research heavy, kind of.
True. True. Yeah.
Even if it was, clinical, well, maybe not say lab research, at least maybe transitional or translational or clinical research. And I was like, I don't see myself, in that kind of research heavy. So I kicked Hemonk, I think by my first year, once I did some rotations, I
Yeah.
kicked it off and I was focusing on critical care,
Mm-hmm.
and infectious disease was kind of like my backup, but I
Mm-hmm.
went for infectious diseases.
That's awesome. So this took you started residency, finished, and then you did 2 years. Is that 2 years for the fellowship for infectious disease? Okay,
Yes.
okay. Awesome, awesome. So did you have so how did this have any effect like residency on your personal life, or was everything just kind of just going smoothly with training and personal life and
You almost have no personal life. Oh, yeah. And residency went by, I think, other than highlights,
Yeah.
I don't remember much, because it was go, I have a propensity, I'm going home first. I'm
Yeah.
going home to sleep.
Yeah.
The thing that's going to take me out, I really need to eat. I really need to show in the house. And maybe I really, really, really need to see somebody or do something else.
Yeah.
So it was a lot. You just get home. I'm tired and I'm like, I'm going to bed.
Yeah.
I just
Yeah.
want to sleep. Give me some food, let me sleep. I did have to have some family in the area. So a
Yeah.
few times you have to work that in, and you have to work it in a very smart way. So luckily, I lived in the city. I worked in the city and we had a train system. I lived close to the hospital, so I would just walk. So I usually would just pack a weekend bag
Mm.
and take it to work. And at work, I would change. And if I couldn't change, I would go to the train station in my scrubs and just go by it, get on the train and just hop off once I get to their place. And then like 5 a.m. on Monday morning,
You're
I get
back.
on the train and I go straight back to work. And that was the time I had, to see family, except they came over. But otherwise, it went by and it was literally just the highlights.
Oh wow. Oh wow.
I
So
remember.
you're done with fellowship now. What made you decide to do locums? Like why decision to do locums?
Locums was, I would say, pivot, and
Okay.
it was a lucky pivot.
Okay.
Um, so I graduated fellowship, and by this time I had moved from the DMV area to Georgia.
Okay.
Georgia, and it was, yeah, to Georgia. Not a big town, more like a college town, so
Mm-hmm.
not much happening there. And because I wasn't quite settled on what I wanted to do, I was tinkering with working abroad, a little bit of global health-ish, but you
Yeah.
know that global health or public health doesn't pay as well
Mm-hmm.
as clinical medicine, but
Yeah.
also the opportunities, how they translate. And that was a point of frustration for me, because they're asking you about all this managing a team, and nobody looks at it that as a fellow, you actually manage a team.
Yeah. Yeah.
Like I'm running people around.
Yeah.
Sometimes you have a team of 8 and you're responsible for them, but they're asking you did you manage a team in a different way?
Yeah.
And like, I've managed a team, not in a way, but getting the same results. And so that was a pain point, because I felt like my skills easily weren't translating or transferring, or they
Into
didn't
that
see it
job
in a
role. Yeah.
bunch of things. So I was tinkering with that because I wanted to work outside the country, family situation, and trying to find opportunities. So because I was very in between, my program had an opening
Okay.
for attending. One of our attendings left, had to move back closer to family.
Mm-hmm.
So we're like, okay, rather than them rushing to fill that, why don't you stay, and while you try to figure out what you were going to do. And I was like, okay, if I'm going to get a clinical job, I'm not staying here. And leaving there made me realize I have to be closer to family. At
Yeah.
least this, I have a choice.
Yeah. Yeah.
So I'm going to be closer to family. So I wanted to be in the DMV area, and I was applying. And as I was interviewing, COVID struck.
Oh, wow.
The pandemic struck, and all interviews just shut down, like, I mean,
Yeah.
nobody cared
Yeah.
about whoever, some, except people who were literally dying to have new staff on board.
Yes. Yes.
um just all recruitment just shut down. So I was like, what am I going to do? And in just having conversations on what to do, locums came up, and I was like, okay, this is a good opportunity. And I had been doing some moonlighting
Mm-hmm.
in the area. So locums was not entirely new
New.
to, but I was like, okay, you sometimes you think it's what people just do part-time or in addition to, but then you realize, no, this is what people do
Full time.
full-time. I'm like, I could do this. And I started in like the summer of 2020. Yeah, I started in the summer of 2020, started like August 3rd. I remember, in Phoenix. So I was like flying from Georgia to Phoenix for work. And it was a wonderful experience. That
Oh, wow.
particular gig served as a bar, because I was spoiled. Like,
Yeah.
we it was a VA, but they were a good team. It was running better than most VAs. It was hospitalist, but I was kind of like on a step down team where we had intermediate people who were coming from ICU but not quite ready for the floor
Oh,
for
wow.
COVID.
Mm.
Um, and we did that, but it was good because they didn't we weren't carrying 20 patients. 12 was the cap. By
Oh,
the
wow.
time you are constantly at 10, they
Yeah.
activate a back team. So that was like, jobs I was getting after, I'm like, what? 20 what patients? I am not interested in doing that. It's not safe. And I've tasted this side of life.
Yeah.
So so that was how I got into locums, and just changed jobs. And I think 3 years later, I'm here.
Awesome. So looking back at your journey now, are you where you are? Do you appreciate your decisions? Like, do you look back and say it was worth it, making the switch, infectious disease? I mean, everything that happened along the way.
Yes. Everything happens for a reason. You look back at it, and if I had done surgery, the interesting thing about choosing surgery was, while I was in medical school and I knew I wanted to do, so I said I wanted to do surgery, and I also knew I wanted to do community work.
Yeah.
I knew I want, and the way I envisioned my community work, I didn't think surgery merged well with that.
Mm-hmm.
And I always prayed about it. But every time I prayed about it, surgery just, it still stayed. So I'm like, okay,
Yeah.
I guess God has
And
a plan. We'll figure it out.
yeah.
Maybe I just don't know how it's going to work, but it's going to work. But
Yeah.
I think that's me. If I wanted to do internal medicine, probably I wouldn't have had that strong urge to leave the country,
Yeah.
because
Yeah.
medicine is not as requiring of too much technology advancement like that.
Mm-hmm.
So I think that drive that I wanted to do surgery was really the push
The
that got me
catalyst.
out of Nigeria, one. And then the timing of whatever application and all of that, I may have gotten, maybe if I had applied the year before, I may have gotten to a program that had some other kind of structure that put me on a different path or whatever it is.
Yeah.
But again, I believe this is the path that God destined for me. So the program I got into, honestly, it wasn't great support.
Yeah.
But again, you think that some doors are closed. It's just because they're not your doors.
Yeah.
And it led me to the door that was mine. Again, the fellowship that I got, the fellowship, they had great support, but it wasn't, one of those ones where you're mentored in a way that, oh, you definitely are staying on this path. When you do your fellowship in a place where their research aligns with your research. That was the research that was happening didn't really align with what I wanted to do. So for me, it was like, if I had someone who their research aligned with the kind of research I was interested in, I probably would have stayed longer in academics.
Yeah.
Again, just
everything for a reason.
Exactly. So by the time I was moving and I moved into locums and I got the flexibility and I had started my nonprofit work a little bit towards the end of residency. So in fellowship, a lot of things were dormant because fellowship was also very, very, busy. I'll leave the hospital at 2 a.m., 3 a.m. I wouldn't know, or midnight. There was one time I left at 3 a.m., but many times you're writing notes till 11. I don't know where I parked my car. I walked around and I would walk past my car.
Yeah.
And I was about to call the police. And my best friend said, let's just sit down for like 5 minutes.
Oh, wow.
And then we'll walk around again. Like, I wouldn't know where I parked my car. And that happened more than one occasion. So that was also heavy on me. But I don't regret it because it really has led me to a place where I'm able to do what I believe I'm called to do. That is my passion, which is the community work that I'm doing. So if I had gone into a more structured, more prestigious program, there would be some pressure to
stay back.
To stay back, do academics, or do it in a certain way. But I've gone to places where I'm just like, I'm gonna chart my path. You people's style did not work for me.
Yeah.
Let me figure out my own style. And that my style is working out for me. I'm applying for critical care fellowship now. And just strength, yes.
Oh, wow.
And just the strength of that I now have infectious disease experience. You worked independently. I've also had the opportunity to do all this outside of clinical work.
Yeah.
That is one thing I have gotten a lot of feedback on, that, oh my God, this is amazing. Somebody literally just told me today, that's inspiration. I was like, oops, me? Okay, thank you. And if everything had worked out, if I had done critical care first, I probably would not have had the time to start or work on my nonprofit
projects. Yes.
I set up a clinic. But ID, it's heavy. It's a lot of work too in its own way, but maybe not as physically tasking as critical care.
Oh, wow.
So
I think I'm quite amazed that you're now thinking of going back to a critical fellowship. So kudos to you. I'm praying for your strength and your grace all the way through.
Yeah, thank you very much. Amen. I talked myself out of it for years, and it keeps coming up. And you get to a point in your life where you're just like, if they're lying to you, why are you lying to yourself? Like, this thing is what you want. Just go and do it. And again, in talking with my best friend, she's like, it's 12 months. What is the worst that will happen? You will hate it with all your guts, but you always have your thing to go back to. It's 12 months. Time will pass. Get that experience, get that certification, and then you figure it out.
That's awesome. Awesome. Well, thank you so much for sharing your journey. Before I let you go, can you just leave one tip that you want to leave for any IMG that's listening to you that you think, will make their journey easier, may have made your journey easier?
Find people, connect with people, talk to people.
Yeah.
honestly. No man is an island. Many times we come, especially as Nigerians, you come in, we're trying to do, I'm avoiding people. I'm doing this, I'm staying on my lane, I'm doing all of that. Or there's just this pride where you think, oh, I can do, you cannot do it alone.
Yeah, absolutely
You
can.
find people, connect with people, talk to people. There's a lot of opportunities. I got in, and then I found out that people can who have done some level of residency training abroad can come straight to do fellowship. So I'm quick to tell people who want to, I'm like, while you are trying to come to America, can get residency training in Nigeria, do residency training, you'll be amazed.
Yeah.
Because I've seen people who come in, they do a fellowship, and then it makes
And
it
they go,
much easier
yes.
for them who are now do the internal medicine or the surgery or the anesthesia.
Residency.
So
Yeah. Awesome. Very, very valuable advice. Like you said, you cannot do this journey on your own. Like you would just be so frustrated and it's really not worth it. Yeah. So I'm so glad that you're able to share this with us. And if you don't mind, can you leave if anyone wants to contact you or reach out to you, ask any questions? Do you have an email or anything you like to share that they can get in touch with you?
yeah, I would say my email, JFK, like the airport,
Mm-hmm.
IDOWU, that's JFK Idowu, at gmail.com.
Okay,
Would be
awesome.
email. But I'm sure if somebody looks me up on LinkedIn,
They'll
they
probably
can
find you.
they can find that and maybe be able to find my other social media just in case. Yeah.
Okay, awesome. And if you also want to join the conversation and we're watching, you can also join us at For MD on Facebook and you can ask as many questions as you want and just try to build that community that supports. So thank you, Dr. Folake, for taking us through your journey. And I see, and there's still a lot more in your journey to go. And so we wish you all the best as you undertake this. All right.